Hi, everybody. Today we're going to talk about social anxiety disorder. So, this is abnormal psychology, and we're working our way through the anxiety disorders. So, social anxiety disorder used to be called social phobia, and then in 2013, with the publication of the DSM 5, it was changed to social anxiety disorder to differentiate it a bit from similar names and similar ideas and to more accurately reflect what it really is. It's in many ways a separate uh, disorder of anxiety. And one of the reasons that we say it's separate is because it it manifests in a different way and for a different set of reasons. So it really is about having a lot of anxiety in social settings where the person is being potentially scrutinized by other people, and they fear a negative evaluation, and so they will uh, respond, potentially even with paralysis, and being unable to engage the behaviors for that particular setting that they need to engage. So these are things that typically evoke that kind of anxiety. It isn't like once in a while they'll feel anxious in a setting. A particular setting will evoke and create lots of anxiety. They may even have a panic attack or a limited symptom panic attack in a situation like that. Again, that doesn't mean that they have panic disorder. So they will avoid these situations. And of course, this amount of anxiety is way beyond what the situation actually would evoke for most people. And so we are really talking about the things that you probably also have some anxiety regarding. The number one social setting for people who have this disorder is public speaking. So if you are in a class and you're asked to give a presentation and you would rather drop the class, or if you had to do it and you believed that it was necessary for you to complete it and you did, you would be petrified to do it. You might endure it, but it would be awful for you. Um, Luckily, there are some Toastmasters clubs in some major cities, and those are groups that meet among people who have this disorder, and they walk them through steps to eventually control their anxiety when giving a talk. This is a very common one. Talking to people in authority, dating can sometimes evoke this level of anxiety. If you watch The Big Bang Theory, there was a character who had so much anxiety he couldn't speak when he was around members of the opposite sex, unless he had something to drink. That's possible, but probably highly unlikely. Making a phone call or answering the phone. Yeah, interviewing, that's a big one. Attending, participating in classes, speaking with strangers, people you don't know, meeting new people, eating, drinking, writing in public. You can see sometimes people who have anxiety eating in public, they'll cover their mouths when they're chewing. Even if they're not talking, or certainly if they have to talk, they'll cover their mouths like this. That doesn't mean they have the disorder, it just means they have some anxiety about that. Using public restrooms. There are people who will not go on trips because they know that they'll have to use a public restroom. Driving, shopping, all sorts of things. So, is there a relationship between some of these and panic disorder? Yes. But in the absence of ongoing panic attacks and only high levels of anxiety, it's not panic disorder. So if driving is intensely anxiety provoking and you don't do it because you believe that others are criticizing your driving and that you are a failure at driving, and not because you have panic attacks, although you may have one once in a while, that's a social anxiety disorder, not panic disorder. Okay, about 7% of the general population meets the full criteria, and that's a high number. That's a higher number than most disorders. Median age is teenagers. The prevalence goes down with age. It's higher prevalence in males, and much of that has to do with the idea that males are more likely to have jobs in which public presentations are more common than females, and so they seek treatment more often. Yeah, to it's uh, although it's equally distributed among ethnic groups, it shows some differences in who gets treatment and who doesn't. Okay. Um, what are the risk factors? Well, there's temperament. So fear of negative evaluation and behaviorally inhibited children who inhibit their behaviors because they fear people are talking about them or thinking about them or don't like them. Environmental could include abuse of various kinds, severe emotional, physical, and any sexual abuse. Um, we know in research that people with this disorder focus very keenly on facial expressions to determine whether there's any disdain or displeasure or even contempt on the faces of those who are watching them. They're much more likely to focus on that anyway, and to detect it, and then to personalize it. Yes. Now, there are genetic and physiological connections. We know at least that through transgenerational information, we know that first-degree relatives are up to 6 times greater in their chance of having social anxiety disorder. If you're looking back within generations of a person that you're treating with this disorder, so one idea is that we are prepared, both biologically and within social settings, to fear rejection, and that has, if that's true, has an impact on taking advantage of reproductive opportunities, doesn't it? So that would impact species survival, potentially. Okay. Well, the treatment of choice is, like all of these anxiety disorders, cognitive behavior therapy that has the most validity and reliability. We need to, in a process of understanding the person's difficulty, is assess which settings socially are problematic, to assess what their behavior specifically is in those settings. What are they thinking about in those settings? That's critical to the cognitive portion of cognitive behavior therapy. We're going to teach them more effective strategies. We're going to teach them how to insert, after looking for any evidence, a more rational series of thoughts than the irrational ones. The irrational thoughts might be, oh my God, they're going to think I'm stupid. And a rational one would be, most people know it's difficult to talk in front of groups, and it's unlikely that anybody is thinking that I'm not worthy or there's something wrong with me. Teach more effective strategies, right? So that includes also rehearsal, okay, maybe in a group, and then offering, of course, relaxation techniques, which is almost invariably offered for people with anxiety problems. Okay, so medications, we don't want to go there. But if the person's depressed, we might go with the SSRIs. Paxil is approved for the treatment of social anxiety disorder, and to some extent Effexor has been shown to be useful. Those are SSRIs. The benzodiazepines like Xanax, no, we don't want to go there. That's just not useful. Now, if a person has overwhelming anxiety, maybe. Beta blockers like propranolol and tenolol, those are better choices. They slow your heart rate a little bit, so you're less sensitive to your anxious symptoms. Okay, so that's a good one. Talk to you later.